Cool.
Yes, absolutely.
Fantastic.
Well, here we are again. Once again, hello and welcome to Afternoon Tea with Docs. My name is Dr. Linda, emergency and lifestyle medicine physician from Sheffield. And oh my gosh, it's so lovely to see so many familiar faces joining us once again. If you're here on Zoom, please do let us know where you are checking in from here in the chat. And if you're watching us on YouTube, make sure you drop us a comment and we'll get back to you. So if you're new to our platform, well, Afternoon Tea with Docs was created so that every Sunday we can bring you lifestyle experts, doctors and healthcare professionals like Dr. Pelumi, I can say today, to help you bust medical misinformation and share practical, evidence-based lifestyle advice that you can implement right away to help you prevent, treat, and reverse chronic diseases. And the point is that it's done in a very supportive community setting here on Zoom. After the recording, you will be able to talk to us in a very private area where you can share your thoughts and ask away your questions. So our events and community is indeed accessible free to all every Sunday. And today we have an extra session on Saturday as well. So if you do want to help us continue our sessions, you're welcome to donate or buy us a tea. And you can check out our donation link in the comments below. A little bit about our guest today. I'm very excited to introduce his very impressive bio, Dr. Pelumi Akindade, who is a UK-trained medical doctor with over 10 years experience in the NHS as a clinician in acute, aging, and complex medicine. In addition, he holds a bachelor's degree in biochemistry and a master's degree in public health. He has a breadth of international experience with his work in the health sector, taking him all the way to South Africa, Nigeria, California, and the USA. Based on his personal and professional experience, Dr. Pelumi believes that health is a vital asset for life. He's a certified lifestyle medicine physician, and he's a member of the American College of Lifestyle Medicine in the British Society of Lifestyle Medicine. He's also a certified health coach, certified life coach, and he is a master of habit change. He's passionate about empowering others to transform their health so that they can truly live their best life. It's so exciting to have you on the show today. Thank you so much for joining us.
My pleasure. Great to be here today.
And we have a really exciting topic today. It is very close to our heart here in Afternoon Tea. It's all about lifestyle medicine and it's all about habit change, right?
Yes, and mine too, very close to my heart. So looking forward to this session.
And today we are going to share a PowerPoint presentation as well to assist our conversation, which is great. And we'll break it up in the middle so that we can have a little bit of a chat about the topic that we are talking about. And if you're here on Zoom, then please do share away your questions. It would be lovely to answer them through the show as well as after. So do share away. We can pop up the PowerPoint presentation.
Okay, let me do that right now. Right, can you see that? Can you see that?
Yes, perfect.
Great. So, Linda, thank you for that kind introduction, and it's great to be with you all today. I'm really looking forward to this session. I hope, and I guarantee it's gonna give you a lot of value. It's going to give you some insight into health, and particularly your health and how you can transform it for the better, obviously. And I hope you get a lot from it. So I'm Dr. Pelumi Akindade, as Linda has introduced me. I work on the front line doing hospital medicine, but I also have a very keen interest in lifestyle medicine, which is my passion really. So I like to help people I come across, particularly patients, clients, to transform their health, move towards optimal health. Because really, when you think about it, your health is vital, essential, foundational to you doing the things you want to do, living the life you want to live, enjoying the things you really want to do. So, on the tail end of that, if you don't, if your health is deficient or lost or damaged in any way, then that can steal your ability to really move towards your goals and your quality of life, your ability to enjoy those things you have achieved. So I really hope that we can, especially in this season of the COVID pandemic, really look to reset our health, regain some focus, get some fresh momentum to really finish the calendar year well and go into 2021 in a better state.
And more than
healthier,
ever,
stronger,
as
more resilient.
absolutely,
Yeah.
more than ever, we need this. We need to learn how to use practical steps to transform our lives. We can see it in the front line. The patients are craving this information, and in the middle of the pandemic, we just need to learn practical ways.
Yes. Okay, so without further ado, let's jump into it. So in this session, we're going to be touching on different things. So we'll look at really what we're thinking when we consider health, how we define health. Health is a vital asset, which is a particular passion of mine in terms of how we shift that paradigm, our understanding of health, and then the health continuum. Then specifically strategies on recovering, protecting, building our health, and using lifestyle medicine, the pillars of lifestyle medicine, in our quest to do that. Got a brief and easy to use framework, which is the RICH framework, which is basically helps us look up, review our health, look at where we want to get to, and then get started on where we want to go. And then some of us might have heard of SMART, which is a way of an effective way of setting goals. And then at the end, towards the end, I'll touch on the 4 C's that I believe are really essential to getting really healthy and moving towards and enjoying life success. Okay, so just to start off, I want us to consider these characters and think about what it is that we want to achieve. Okay, what is it that is particular and personal to you that you want to attain, achieve, experience, see in your life by the end of this year? We're moving towards the end of 2021, next year, 2022, and beyond. Okay, so what are the things we aspire? What are our aspirations, dreams, ambitions, goals? Okay. And also, while we're doing that, and do feel free to share in the chat what some of those things might be, if you want to share them, how that relates to our health. Okay, so as I alluded to before, our health really is important to get us towards those goals, and also important in sustaining us and allowing us to enjoy those achievements. Okay, so I'll let you think about that for a minute or two, and maybe Linda might want to jump in here as well and add to that, because it's personal to each one of us, but it's nevertheless important, and health has been foundational to help us move towards that.
As we could see through the pandemic, really our health is everything. As you said, without it, we can't do anything. And the fact that we are putting it second after our careers, second to our families, I don't want to be sexist here, but really women do try to do it all, right? They put their careers front. That's a lifestyle choice. They put their kids, their husbands, their housework. And nowadays, more and more, also men are doing it too. But it is something we have to recognize, that we need to take care of our health, and number one first. Yes.
Just going through these pictures that I've chosen, we've got Arnie, who most of you probably know, had ambitions to be a bodybuilder. He had a history to that, and he was celebrated as a champion bodybuilder many times, and he needed to be in good shape for that. But also, if you look at the course of his life, not that I'm not his biographer, but he went on to do other things. So he went on to be a Hollywood actor. He went on to be, I think, governor of California in America. And so his health was very important, if you think about it, in helping him to achieve those things. But look at Emma Raducanu, who this year just surprised everyone, probably even herself. But really, it was a beautiful achievement for her to win the US Open women's single title. But it wasn't by accident. There was a strategy. And a key part of that was her health, maintaining good health, discipline, consistency, having a good community around her. All these we'll touch on, and they're very important in helping us move towards optimal health. Nelson Mandela, one of my personal heroes. Some people may or may not know that he was actually he was a keen boxer, not at pro level, obviously, but that's one of the things that kept him physically and mentally disciplined and fit in his fight against an oppressive apartheid system. And then he went to prison and spent, I think, about 27 years in prison, in which period probably a lot of people in a similar state probably wouldn't have survived. Okay, so he had built up a certain level of resilience, physically, mentally, to be able to survive that. Obviously, he probably didn't see it coming, but he had that resilience already, and so he was able to survive that experience and then go on to become president of South Africa. And then we've got our beloved Queen Elizabeth, who is still going strong in her old age. And again, I would say that's not by accident. I think she has very good people around her, and I think she has I think she has probably some very healthy habits that she maintains and has maintained all through her life to help her still to be in relatively good health in old age, and see her children, grandchildren, great grandchildren, and just continue to thrive. So I thought it was just worth reflecting on those characters, and as we reflect on our own personal health. So COVID-19, we can't get through this presentation without some kind of mention on COVID-19. I'm not going to go into the science behind it, but just to say that our health is always under threat from something, okay? And also our journey through life and towards our ambitions and goals are going to be fraught with different challenges, and it's important to have the resilience strategies to be able to reduce our chances of succumbing to them. Okay, as a frontline medical doctor, I've in the first wave of the pandemic, I was actually infected with COVID-19, and very fortunately, only experienced 48 hours of very poor health, and I was able to bounce back. But some of my colleagues didn't make it, very sadly. A lot of my a lot of patients didn't survive it, and we've all been really hit and touched by COVID-19 in some way. But I think one of the things that it's made me think about more is what we're just discussing today. How can we reduce our risk of having the complications from diseases such as these? They don't always, these challenges and threats don't always have to take us out. Okay, and we can put ourselves in a better status and position to be able to conquer them. As we know, Omicron, however you pronounce it, is going to be, the predominant variant very soon, and a lot is still uncertain. But some of the things that are certain is, how a lot of things are still in our hands into how can we prepare ourselves. So when we think more about defining health, we have a good working definition from the World Health Organization. So a complete state of physical, mental, and social well-being, and not merely the absence of disease and infirmity. And we know that health is multidimensional, and it's many components to it. And it's not just about treating disease and throwing pills and at people or sending people for procedures. There's a lot more to our health than that. And I think more and more it's coming to the fore that looking at health more holistically is so important and key to our lives. So if we can pause, and I gave you a few questions to think about earlier, and this is another one that's tied to that. So what does health mean to you? We've got an official definition from the World Health Organization, but really it's important to think about, what does it mean to you? Does it mean, some examples, does it mean I want to be able to see my children grow up and walk my daughter down the aisle? I want to be able to fit into this dress for my wedding that's coming up. I want to be able to, whatever it is, I want to be able to reverse my type 2 diabetes, or get my blood pressure under control to reduce my risk of stroke. I want to reduce my chances of having cancer like my father or mother did, whatever it is. So I want you to really think about that. And Linda, again, I'm going to invite you to interject on this, because I think this is something we could discuss a little bit.
Yes, I think it's very important when we look at lifestyle choices, and the decisions that we make is made based on our why. Because that why and the reason behind it is what will help us to continue the changes through our whole life. It is hard to have to think about our health in the midst of everything that we do in this busy lifestyle that we have to maintain. So for us to be able to maintain that, we need to find out with brutal honesty and loving kindness at the same time, what is the why that pushes us? Like you just mentioned, Pelumi, either we want to prevent us having cancer in the future, or we want to be there for our great grandchildren, or we want to become great athletes. Yeah. For all of these reasons, there is an answer in practice through lifestyle medicine, but we do have to start with the why, for sure.
Yes, yeah. I think, is it Simon Sinek, but it's big on what is your why, and I think it's really important, and that gives us a focus, doesn't it? It gives us a reason, because I think, again, a lot of people are maybe certainly the health enthusiasts, the people that like weightlifting or going to the gym, get some buzz from that, but there should also be a purpose. There should be some greater purpose, right? It enables us to do something. And
also within that why, we talk about lifestyle, but instead of living for the lifestyle through the why, we live for a purpose, and we optimize our lifestyle to match that purpose.
Yeah. So important. So this is one of my kind of guiding, philosophies on health. Okay, so health is your vital asset for life. Okay, what is an asset? It's something of value. It is something of personal benefit, and it's a resource that we can draw on when we need it. Okay, so different people will have different experiences and understanding about what an asset is. Whether it's your house, whether it's your car, whether it's your education, whether it's your art collection. Some people have interesting and well invested portfolios. Well, what is an asset? An asset is something of value, and health is our personal and very vital asset for life. Um, it's often the truth that we don't really think about our health in a personal way until something goes wrong. So whether it's, you stub your toe, or whether, you've been given the bad news that, you've got maybe diabetes or cancer or something like that, we don't really consider, we often take our health for granted. So here we have what I basically put um, uh, a diagram here that shows the health continuum. So on one end, if you look at the left end, the red end, you see someone who is maybe in a critical state, has an acute condition. They need to go to A&E or see their doctor about something. Maybe they are having a stroke or heart attack or serious diabetes complication or a serious infection, and they need acute interventions to stop them from further deterioration towards death. Okay, and our conventional health systems, if you're in the UK, our NHS, and they're really focused at that's their orientation. But really, when you stand back and look at the whole of health, that's not all there is to health. There's so as much as we love our NHS, and as much as we love our doctors and nurses and other healthcare professionals, most of the time the system is really, at best, helps us back to that neutral point. Okay, the other end, you've got optimal health, where someone is thriving, someone is very resilient, someone is moving towards achieving their life potential, someone is just very productive, and that is the ideal state, right? But it takes a certain insight and commitment and intentionality to realize that. Awareness, education, commitment to growth, personal growth, both mentally and physically. So our health systems are not geared to help us move towards that state. But lifestyle medicine is, and we're going to consider some of the pillars later on. A few health stats for you. This is much of this from the World Health Organization. 80% of heart disease, stroke, type 2 diabetes, 40% of cancer are preventable through diet and lifestyle. These are huge numbers. It's both sobering and optimistic, actually, in outlook. So it means that a lot of these diseases, which cause a lot of morbidity and mortality the world over, are actually preventable, and preventable without spending loads of money. They're actually easily achievable. So it's worth thinking about these things. 11 million deaths globally can be attributable to unhealthy diets. Tweaking our diet to make them more healthy can actually increase both our lifespan and the quality of our life. Okay, so it's worth thinking about these. Mental illness costs the global economy $1 trillion per annum, per year. That's a lot of money lost to ill health. And we know that physical and mental health are related. Stress, depression, anxiety, burnout, suicide are on the rise. And more so in the current state of the world, which is still going through this pandemic. This pandemic is not over at all. And certainly not in my profession, medical profession. Burnout is on the increase, and it's very concerning. But again, there's something we can do about that sobering picture. I've touched on conventional versus lifestyle medicine. So our conventional health systems are focused and geared towards, it's very reactive. It's not really being on the front foot. We are reacting to poor health and health acute crises, and less so, we're not really dealing with the root causes. We're not really, if you look at the picture, we're not turning the tap off. It'll be the common sense thing to do, wouldn't it? We're busy kind of mopping the floor, and that really doesn't really change the picture. We need to tackle the root issues. Some of my patients and clients sometimes say, "Well, it's all right for you to say that, doc, but you know, I'm my genetics are responsible. I'm gonna develop such and such. I'm gonna develop diabetes, or because my dad had it, or my mum had it, or my mum had a heart attack at age 40, or whatever it is." But there's a lot more to the picture than that. Yes, there are some things that we are predisposed to, because maybe what we have inherited through our parents or as our environment, family history, but there's a lot we can do that influences that. A wise man once said, "It's genetic loads the gun, but it's lifestyle that pulls the trigger." Okay, so how well are we eating? What are we eating? When are we eating it? How active are we? How much physical exercise are we getting? Are we moving towards a healthy weight, maintaining a healthy weight? Are we keeping an eye on our blood pressure? Are we watching what we eat that may be pushing our blood pressure up? High salt, high saturated fat, etc. Are we smoking and drinking? And yeah, what other medications we're taking? Interestingly, some of the medications we take will, or that we're prescribed, will cause certain side effects, and then you might get another prescription on top of that to tackle that side effect, and so it goes on. But there's a lot we can do to reduce our risk factors for getting many diseases. Type 2 diabetes is just one of them. Heart disease, cancers, dementia, which is going to be big in the coming decades, because we have an aging population. So even more imperative to really look at our lifestyles. So part of my message really is, how can we do this? Well, I think we need to start with taking personal responsibility for our personal health. Yes, our GP or specialist and other healthcare professionals are there to help us, but really we should be taking real ownership of our personal health and really being very intentional and proactive to be healthy. So I want us to really think about this thing: recovering, protecting, and building our health. Health being a vital asset for life. Okay, so we need to get informed, get the right information. And there's a lot of misinformation out there, but we need to get the right information, look at the sources of information, and then protect our health, invest and build our health to enjoy now and in the future, right? And I want to say that it's not just our personal health. It's not just important for us, it's for those around us, isn't it? So think about it. Your loved ones want you to stay healthy so that you can spend quality time with them. Your colleagues need you to be healthy. So one, you can show up for work and be productive and be your best self and be creative and problem solve and all that kind of stuff. So good health is not just, it touches everything around us really. And resilience is key to be able to, life being life, we're going to get knocks. That's reality. Things like COVID are going to come along, and it's already been, even I think in the past week, I forget her name, the inventor of the AstraZeneca COVID vaccine has even indicated that we will have other pandemics in the future. But how prepared are we going to be? How resilient are we? Are we invested in our health right now? But I believe we can thrive. We can build our health and reset our health in a way that helps us to thrive. Okay, and so here are the
move on. I would just love to ask our guests and our listeners here on YouTube if they are aware of those statistics. I would love to hear in your comments or in the chat here, have you heard about the fact that such a huge percentage of cancers and chronic diseases such as diabetes and heart disease, they are preventable. You can see 80% of heart disease, strokes, type 2 diabetes is preventable. And actually, I think that's even higher. 40% of cancers are preventable. And we know that only 10% of all cancers are genetic. I would love to know if our listeners are actually aware of this, because I think we do a great disservice both to ourselves as professionals and also to our patients by not having the time to discuss this with our patients every time before we prescribe a medication.
Yeah.
I think very rarely are we allowed the time and the space where we can speak to our patients about these facts, allow them to take this information home, digest it, and think if they would like to go down the lifestyle medicine route or the medical route. And I think because of this, we continue feeding our patients into the Pharmageddon, that I like to say, and the diet industry, where they're constantly trying to navigate through this misinformation that you just mentioned. And that leads them into the questionable practices, which I think we need to take responsibility as doctors as well, as patients, but also as a national health system to see what can we do to allow the space and time for both patients and doctors to be able to have that conversation. Because unfortunately right now, even though we would love to do and love to have this conversation with each other as co-partners, as you are doing coaching for your patients outside, a 10-minute consultation is just not going to cut it. It requires,
it's not, is it? You're right. You're right. I mean, yes, it's unfortunate that, you know, the health system we function in, as much as on paper, I mean, I think it's lip service much of the time that, you know, we're doing preventive health. It's actually not reactive, and we don't really have time to really invest in our patients and ourselves to be healthy and to exemplify that, to show them the way. I think we really have to be prepared to buck the trend sometimes and just really say, okay, well, this is important for this patient. This is important for our patient. I mean, I remember, you know, being on the COVID wards in a hospital, and you know, seeing, you know, in a non-judgmental way, just trying to help some of my patients to make the link between their lifestyle and the complications they were experiencing with COVID. And so we had, you know, very real conversations about, you know, getting back to a healthier weight and the benefits of that and how that can happen. But I mean, that wasn't every conversation. That wasn't every obese patient that I could talk to about that, because, you know, there's no time. You've got to get on with the water, and there's lots of things happening. You know, there's not enough staff, you know, to get all the things done. And so, you know, you just, you know, so busy with in the workplace reacting to stuff that there isn't really enough time to really invest in helping people move towards better, optimal health.
Absolutely.
So, yeah.
Yes, we are reacting to everything nowadays. To social media comments, it's a reaction. It's just like, boom, I don't like it, I like it, I agree or I disagree. It's the hate-love relationship, and we really need to move away from that kind of language and be proactive so that we can address the root cause of diseases and the root cause of our unhappiness. So lovely. So let's look at the pillars of lifestyle medicine.
Yes, let's do that. I thought you never asked. Right. Okay, so here are the 6 pillars of lifestyle medicine. Nutrition. What are you putting into your system, and what is it doing to you? So the food you're eating, is it nourishing you or causing you harm? Again, we know that, you know, fast foods, highly processed foods, generally speaking, high in things that are not so good for us: sugar, salt, saturated fats. You know, in large quantities, not good for us. how much exercise are we getting in a day, in a week? Ideally, we should be moving towards 150 minutes of moderate level intensity exercise per week, roughly speaking, between Monday and Friday or Saturday, 30 minutes a day. Are we smoking tobacco? Are we, and how much alcohol are we ingesting? If we are smoking, can we look at quitting? Our modern society and lifestyles have created a highly charged stress state. Stress is unavoidable, I should say, but we do need a certain amount of stress to get us moving. But when it becomes a chronic, prolonged picture, it's certainly not good for us, and it sets up an inflammatory state where, and that predisposes us to heart disease, cancers, a lot of poor health. So, as well as mental health consequences of that, depression, burnout, suicide. So we need to look at the ways we manage stress and do that in a constructive way. How much sleep are we getting? This is one of the certainly one of my revelations in the past couple of years, that quality sleep is so foundational to our health. Quality sleep is important for us, so that we don't develop type 2 diabetes, heart disease, cancers. We develop good immunity. We concentrate better, and which impacts our performance during the daytime. And sometimes, I remember going through my studies, including medical school, and pulling the all-nighter to study, was a normal thing. And so there was a trade-off. We used to do that to make sure we, especially around exam time, and I'm sure many of you are familiar with that kind of practice, but it's not good for us. And so I've done certain things in my personal life that moved me away from that. Healthy relationships being the sixth pillar of lifestyle medicine. Are we investing in the right relationships, healthy relationships, connecting with people? I think one of the things that again has been highlighted throughout the pandemic is how how much loneliness has affected people, and then the consequences of that. And so connection, good connection, social connections are important. Health relationships are important. Your relationship with yourself and your relationship with other people is important. So these are the 6 pillars of lifestyle medicine, and then I think it's important to explore these in more detail. And certainly what I do with my clients is take them through these 6 pillars and look at what is the current practice, which is usually eye-opening for them, and then look at how we can strategize to move towards the ideal in all of these 6 pillars, so that you can get healthier and enjoy that.
And Kirsty just mentioned in the comments, really rightly so, that we should encourage physical activity and movement. And that is exactly what lifestyle medicine states. And the studies are very clear. Just moving throughout your day, meaning not taking the lift and taking the stairs. That's already movement. That is really adding to your health. Just standing up every 2 hours from your desk already reduces your chronic disease risk. There's correlation between just standing up every 2 hours and active physiological mechanism that helps you in the long run. So just such a small tweaks can make such a big difference, right?
That's right. You don't have to join a gym to be healthy. You don't have to buy the top end food to be healthy. So I'll give you some examples from my personal life. So nutrition wise, I remember moving to whole. So the ideal diet is whole food plant-based diet, right? So I remember trying to move towards this and just substituting white rice with brown rice, wholemeal pasta, wholemeal bread. Sorry, the white equivalents of that for the wholemeal equivalents of that. And then even with that, you don't necessarily have to swing to the other extreme immediately. It may be that you might want to do it in a more graded way. So for instance, if you're used to white rice, for instance, you may want to just, take substitute quarter of the portion with brown rice, okay, as a starting point, right? So it doesn't have to be, I'm going to take the whole thing away now and and substitute it with the whole grain version, which is ideal, but it's not always possible for everyone. And sometimes making that transition, we can make that transition easier for people. And so yeah, that would be one example. I think, even upping, saying, okay, well, I already eat 5 portions of fruit and veg a day. Can I add one more? Or I don't eat any fruit and veg a day. Can I add something to that? So it doesn't necessarily mean we have to go to the other extreme immediately, because sometimes that's not possible, it's not feasible, it's not affordable, it's not, there are different reasons, but we can do it in a gradual way to make it achievable. And those small changes make a huge difference, right? Exercise, as Linda correctly said, take the stairs. You don't need to take the lift or the escalator at a time. For me, I used to do a lot of sport when I was younger, but working life and having a young family, I can't engage in the same things anymore. But I've got 2 young kids who are very energetic and run around. I enjoy dancing with them, jumping up and down with them. That's exercise, right? So I don't need to go to the gym to keep fit. I just need to look at my day, look at my surroundings, look at my life, and just try and work it in, right? It's so much easier than what a lot of people think.
And it's so powerful. Just to stress that one of the studies showed that by trading just 2 minutes sitting from sitting to light intensity exercise every hour, it lowered the risk of premature death by 33%.
Yeah.
That's just...
It's staggering, isn't it?
So the importance is not that you sit for 10 hours or 8 hours a day at the office and then you go to the gym for an hour. Just changing the mindset around getting up every hour just for 2 minutes will already prolong your life and your life quality, most important.
Yes, quality of life as well as longevity. Yeah, those are key. And if you look at the study into the blue zones, Dan Burtner, it was the communities that were living the longest on the face of the earth are they're not necessarily bath gym goers, right? They do exercise as just part of their normal day. I was in California a couple of years ago, and I was keen to visit one of the blue zones. So Loma Linda in California, I was interested in just the lifestyle, the way of life of these some of the healthiest people on the face of the earth. They just in their normal lifestyle, they are healthy, and so it's achievable. It's so achievable, and the benefits are incredible, and the side effects are all positive ones. All right, so sleep is something I've been recently read Why We Sleep, quality sleep. So not just haphazard sleep, 8 hours here, 8 hours over there, but consistent, same time to sleep, same time getting up, aiming for 7 to 8 hours quality sleep per night, and also things that help make that achievable. So looking at our sleep routine, looking at how much we're using our phones, blue light emitting devices, right? I think a lot of us, myself included, until I became knowledgeable about this. You take your phone to bed, you're still checking your phone right up until the moment you want to sleep. But really, we should be, putting that thing away. I'd say at least an hour before hitting the hay, so that because we know that the physiology that governs sleep, our melatonin release, our circadian rhythm are interrupted by certain things, right? Including blue light, the blue light spectrum, which are emitted from most of our phones, our computer, our computer screens. So, like if you don't know these, you wouldn't really consider.
The lights there, just if any listeners are watching and they never heard about the blue lights and the different light colors, blue lights are the worst. They're on our computers. That actually reduces our melatonin release as we go into sleep mode. So if you want to improve your sleep, early morning, wake up and get bright light from the sun. When you wake up, have a nice hearty carbohydrate breakfast, and that will reduce the effects of the blue light at night if you are very attached to your phone and your computer. So very bright light in the mornings. And if you want to counteract that a little bit, you can get a red light in your living room to relax to at least half an hour before you go to bed, to counteract that blue light effect. I think that helps quite a few patients.
Yeah. So right from getting up in the morning, try and get as much sunlight as possible. Try and get outside if you can. When I'm feeling really energized and inspired, I'll go out first thing in the morning, and get that exposure. And if you can exercise during the day, that's great. I mean, I don't always manage to exercise during the day, but one of the things I do is I intentionally go out of the building at lunchtime and just take a walk outside. It's pretty simple, straightforward thing to do, but it does make a difference. I watch, I make sure that I'm not taking anything caffeinated after lunchtime, because actually, it can stain your system and affect your sleep rhythm. So really, really simple things. I usually shower at night, hot bath or shower before sleep helps you relax, and increase your chance of really good quality sleep. Like so many things little tweaks we can make in our lifestyles can make all the difference to really getting really, really healthy and enjoying the benefits of it.
You mentioned that you, just as all of us are familiarizing ourselves with lifestyle changes, that you also just kind of familiarize yourself more with the power of sleep. I always think that if they would have taught us, or if we'll teach our junior doctors about lifestyle medicine and the side effects of poor sleep, poor diet, lack of exercise, then I don't think they will go through medical school. I mean, that's medical training, because this is literally medical training. They take away all of these lifestyle aspects so that we can get through training. So I think we do have to advocate, hopefully for the future, for junior doctors, that they don't have to go through a grueling culture where lack of sleep is actually, how do you say it?
It's almost celebrated.
Exactly. The less you sleep, the more of a hero, the more of a monster you are. I did 48-hour shifts without any sleep. Well,
but it shortens your lifespan. We're not taught that. I didn't know that until a few years ago, that it actually shortens your lifespan if you're not getting enough sleep.
Have you gone through training?
This is it.
Right.
You
So
know,
it's a catch me
but
22.
I think I would have done it in a more informed way, right? So there's certain things that I wouldn't have done, but I think to know the facts, to have an understanding of that, then it informs your choices. Then you can choose. You know, you can choose what you're going to do.
At least it allows us to shift the culture, because very often as juniors we are not aware of our voice, and really we just
Yeah,
go with the culture as our patients go with the culture of their
yeah,
own environment, and that's a big problem as well. It's
yeah,
very hard to go against our social norms and
yeah,
change our habits, but I think informed decisions would allow us to shift that culture,
yeah.
and educate our community.
Yeah, absolutely. And you know, also the research is there. I think certainly when I was preparing for my certification exam in lifestyle medicine with the American College of Lifestyle Medicine, you know, the healthiest doctors, or the healthier doctors, are also the ones that are more likely to help their patients adopt healthier practices. So you know, if I don't know, you know, if I don't know what good nutrition is about, and how that can impact health, I don't know, you know, how important you know, enough exercises. I mean, you know, it's usually, you know, you need more exercise or you need to lose weight, but what are the specifics of that? What does that actually look like? You know, how can this person in front of me how can they achieve it? You know, how can they achieve it without, you know, breaking the bank, or you know, how can we make it attainable for them? I think those we're not taught that in medical school. We're not taught that in our training, and it's actually very important, because we're there to help people move towards good health. We're not there just to firefight and to, you know, react to the next thing. We should be there to help them play the long game, and being healthy is a long game, right? It's not sexy, but it's a long game. It's a long game. It's a long-term investment. It's consistency, and you have to be committed to that. Do this day in, day out. You know, develop these healthy habits for the long term, and that's really how you reap the benefits of them. Okay, so let me move on. You're probably getting bored with this slide, so I'm going to move on. Okay, so so eat to nourish. This is one of my little phrases. Eat to nourish. So this is an example of a healthy plate. This is not necessarily what I eat every day, but the principles are there. Okay, so very colorful plate of different fruits and vegetables, and that correlates to different healthy chemicals, basically, in the fruit and vegetables, that help us stay healthy, that help us fight disease and stay healthy. Phytochemicals, plant proteins. You don't have to, you know, there's a myth that, you know, you need plant protein to be healthy. Only meat has a protein you need. Well, that's not necessarily true. There's a lot of plant-based protein options that are there to be explored. Beans, legumes, etc. And as I touched on before, whole grains. So moving away from highly processed foods. You know, one of the things that's interesting to note, and I'm sure, you know, many of you know already, is the importance of fiber in our gut. And if you look at the, you know, the studies that show, you know, the correlation between those that eat highly processed food and no fiber at all, and the incidence and prevalence of colon cancer, right? So it's so important that we start moving away from highly processed foods and actually start eating whole foods, and, you know, in their more natural form as much as possible. And doesn't necessarily have to be difficult. Healthy food is not untasty. Is that a word? Untasty? A lot of people think that, you know, You need, all these additives and sugar and salt and oil for it to be tasty, but you actually don't. I think this was a study done at Imperial College London, which basically looks at, fruit intake and the risk of heart disease and stroke. Without going into too much detail, basically the more fruit and veg you eat, the less your the lower your risk of heart disease and stroke. I'm conscious of the time. And this is a quote from T. Colin Campbell: "Everything in food works together to create health or disease." So actually, every item you eat is either moving you towards, if you remember the health spectrum, moving towards optimal health or away from it. Get moving, get exercising. What are the benefits of exercise? Well, it improves sleep, it improves executive brain function, it reduces depression, it improves anxiety, i.e. reduces the risk of anxiety. It helps you maintain a healthier weight, it reduces your risk of cardiovascular disease and cancer. To name just a few, there's so many benefits of moving. And as I said before, to be aiming to getting 150 minutes of moderate level exercise per week, and also to avoid sedentary behavior. I know Linda said earlier, trying to stand up every couple of hours. I reduce it down to my clients to 20 to 30 minutes. Set the alarm on your phone. Every 20 to 30 minutes, I'm going to stand up and do a little stretch, or do a little jump, or do a little walk around the chair. Something really simple. But every 20 minutes, I'm going to stand up from my sedentary position. It makes
our patients also, and our listeners, with the thought that any movement already reduces the risk of disease. So there's a correlation between 0 and just 5 minutes already, 3 minutes, 2 minutes, 1 minute, whatever it is. Just get up, stand up, stretch out, and that momentum of just moving for 1 minute will propel you into 5, 10, 15 minutes. But don't think about the overwhelming idea of having to go to the gym, having to go run my 5K, 10K. Who cares about the 5K? We are not athletes. We just want to get moving. Let's just go out for, how about I'll run up my staircase, and it will add to your health.
Yeah, definitely. So just do it.
Just do it, yes.
All right. Sleep. We've talked about sleep, but yes, there's a big difference between good quality sleep and not sleeping at all, or poor quality sleep. And as I was saying before, there are strategies that we can adopt to help us sleep better and reap the benefits of that. Stress management. How are we managing our stress? We can't avoid stress, right? But if you're alive, you're going to experience stress. But how well are we managing stress? Do we turn to things like smoking, alcohol, illicit substance use, unhealthy behaviors, which may seem to help us cope with it, but actually we're doing ourselves a lot of harm and disservice by adopting those behaviors. But there are ways to manage stress better, whether it's exercise. We've just talked about, it has many benefits. Getting out into nature, connecting with others, mindfulness and yoga and meditation. There's so many ways that we can manage our stress better. So we have to consider that. I've touched on substances and stimulants: tobacco, alcohol, caffeine, illicit substances. And I think last but not least, connection, healthy relationships, connectivity, community. This is really important for our health, and the research is there that supports this, that those more connected and in community and in a community where you have shared values, you're moving towards a shared goal, you're supporting one another, it impacts your health in a positive way. So moving on from the pillars, this is a very short and simple framework that I developed to help you move towards health. So if you think health is an asset, it's valuable, and health is wealth, and so you need to get rich, right? So let's review and reflect where we are. What is your current health status? What are your current health challenges? What are your current health concerns? And where are you in relation to that? What is your blood pressure? What is your weight? What is your body mass index? What are your eating habits? Are you exercising enough, etc., etc.? And then what are your goals? What do you want to change? Okay. After establishing that, what is my knowledge gap? What do I need to know more about to help me make informed decisions about how I need to change this, right? And then I need to change. I need to implement those. I need to get on with it. I need to take action today. And with taking action, we're going to get on the highway to health. It's a long game. Okay, consistency is where we're going to see the benefits. Okay, and you're going to get, there are going to be challenges along the way, but as long as you keep moving and adopt the right strategies, and with the right support and help, a coach being one of those, by the way, you can really fast forward to your optimal health. Just something very briefly on goal setting. Goals should be specific, measurable, achievable, relevant, and within a time frame. Okay, those are the best goals. So think about what you want to achieve in 2022 in your life, in your health, and start formulating your goals using this framework, and you're more likely to achieve them. And a little diagram just to highlight the stages of change. Okay, so even in this short session, some of you hopefully will be at a certain level, whether between somewhere between 1 and 6, and hopefully what this session has done is help you move to the next stage. Okay, so maybe certain things you didn't know or appreciate about your health before, and now you do. So you move from pre-contemplation to contemplation. Now you're thinking about, okay, wow, I need to do this. I need to start thinking like this. I need to make certain changes. Some of you may have been thinking about something for a while, and this session has spurred you on to take action, right? I'm gonna commit to adopting a healthier diet. I'm gonna eat more fiber. I'm gonna aim to do 150 minutes of exercise per week, or whatever it is. Okay. It's also important to say that, okay, in all this, the reality is that many of us will still relapse at stage 6 on this diagram. And the important thing is just to pick up and keep going, right? So even if you relapse, you can, you don't have to beat yourself up about it. We can keep going, all right? So last slide, my 4 C's for life and for health and life success. Very simple, but very important and powerful. Community. So I think what Linda and team have tried and are developing, which is really great on this platform, is a community of like-minded people that are thinking about their health and wanting to make healthy choices and changes to move them towards optimal health. So belonging to a finding community, finding your tribe of like-minded people that have similar values to be healthier and to move towards that, to support one another to do that is really, really important. Making a commitment to be healthier, making a commitment to discover and experience the best version of yourself, I think is important too. Consistency. Okay, so let's say I want to increase my intake of fruit and vegetables, and I just I'm not eating any vegetables at all, and I have an apple tomorrow, and that's it. For another month, that's really not going to make that much of a difference. But consistently, day in, day out, making certain, and it doesn't have to be huge. Okay, and last but not least, a coach. Now, what is a coach? A coach is really someone who holds you accountable. A coach is someone who brings out what's in you that maybe you weren't even aware of, your own potential, your own superpowers, your own ability, your own there's so much potential in each and every one of us, but it usually takes someone out of us to help bring that out, right? So in my job as a coach, I try and help people to become a better version of the best version of themselves, really, and I champion them, and I help them to move towards that. So a coach is someone who shorten that journey, they accelerate that journey, they help you across a bridge, they help you achieve what you want to achieve, they help you achieve your goals. So that's really important. If you the principle is that we see it a lot in sport. So even the elite athletes, they'll sometimes change their coach. They've already achieved so much, but they change their coach to bring out something else in their game. So yeah, I'm not going to labor the point too much, but it's having a coach can make such a powerful difference to your life. So lastly, I'm going to say to you, you can do it. You can become the person you want to become. You can achieve the things you want to achieve. You can be your healthiest self. Your 2022 can be better than your 2021. All right. So you can do it. You can transform your health. Thank you very much.
Thank you so much for this really inspiring talk. You can see your links to Instagram, LinkedIn, and your email address if they would like to get in touch. Are you also doing coaching right now privately as well?
I am doing coaching, both one-to-one and group coaching, and this is something I want to develop more in 2022. So I want to build up, do it in a more effective way, and do it in a more scale that, really. So do get in touch with me. Tell me the challenges you're facing or the concerns you have about your health. The more insight I have about the common things that people are struggling with, the more I can orientate myself to strategize to really help them with that. Because Linda, Erica, myself, other healthcare professionals, we can have our own agenda. I think you should lose weight. I think or you need to reverse your diabetes. I think you need this. I think you need that. But really, what is the other? What is the patient or the client? What is their concern? What is their what are their ideas, concerns, expectations? Related to their health. What's most important to them? And so the better that we as healthcare professionals and coaches, the better we can have an appreciation of your needs. The more we can work together and really have the most impact and achieve even more amazing results.
Your patients are very lucky to have you with over a decade of experience in medicine, coaching. That is just a vast amount of experience that everybody can benefit from when they are with you. So thank you so much. Thank you for everyone who has joined us on YouTube and on live stream on Facebook. For those who have joined us here on Zoom, we are going to go to our non-recorded session now, where we can just chat and have a really protected community environment where we can talk about your questions, and hopefully Dr. Pelumi can answer them. more extensively rather than here on the chat. So if you are new to Afternoon Tea, we love to hear from you and how you're doing. So do join us on social media. We are on Instagram, Facebook, and on YouTube. You can watch all of our previous episodes by clicking on one of the subscriptions on the below and the links above to our different videos. On Instagram and Facebook, you can follow us at Afternoon Tea with Docs. So we hope to see you there, and I hope to hear from your lifestyle journey. So thank you very much. See you guys later.
See ya.